Hello, everyone. My name is Diana Solis, and I will be doing my presentation on congenital heart defects. So what are congenital heart defects? Congenital heart defects occur when there is an abnormality in the heart that develops before birth. This is a result when the heart or blood vessels near the heart do not develop as they normally should before birth. Some facts about CHDs are they're most common birth defects. They are diagnosed during pregnancy, but they may not be known until birth. CHDs affect nearly 1% or about 40,000 births per year in the United States. Congenital heart defects can include holes inside of the walls of the heart. They may be narrowed or leaky valves. Some severe cases of CHDs, the blood vessels or heart chambers can be missing, poorly formed, or they may have developed in the wrong place. There's about 35 or more known congenital heart defects that range from being very simple to complex. Some of the most common CHDs are ventricular septal defect, atrial septal defect, and bicuspid aortic valve. We have some examples in this picture. As you can see to the left, there's a hole between the top heart chambers. This is called atrial septal defect. It allows the oxygen-rich blood to leak into the oxygen-poor blood chambers in the heart. To your right, that is a ventricular septal defect, which is a hole in the lower part of the chambers, and it causes higher pressure in the heart or reduced oxygen into the body. So most cases of CHDs, there's really no known cause for them. There's a thought that there might have been something that affected the baby's heart development during the first 6 weeks of pregnancy. But some risk factors that could cause the heart defect is there's an abnormality in an infant's chromosomes, an individual gene defect, the mother's health, diet, or any medication use, environmental factors, or substance abuse like smoking, drinking. Certain conditions for mother like obesity and pre-existing diabetes has been linked to heart defects in babies. But in most cases, congenital heart defects are considered multi-factor inheritance, meaning there's no identifiable cause for the heart defect. In my diagram that I have here, I have some modifiable risk factors like the diet, substance abuse, obesity. I know diabetes, you can't really modify it, but you can definitely modify your diet, increase any exercise. There's air pollution, some non-modifiable risk factors, of course, medication. So if you have any, if you are, have any medical conditions like epilepsy, if you, have any mental disorders, infections, we have metabolic disorders, race, and genetics. Some demographics are about 30% of children with abnormal chromosomes that result in a genetic syndrome like Down syndrome are born with a congenital heart defect. When a parent has a congenital heart defect or has had a child that was born with a congenital heart defect, they have a 50% higher chance for each child to be born with the same defect. Males and females are equally affected. And then we have some just more facts about CHD. Okay, so a couple more facts. We have In 50 states, they now require pulse oximetry screening, which can identify critical congenital heart disease in newborns. About 45% of babies admitted to the Children's National Cardiac ICU were prenatally diagnosed with CHD. Researchers estimate that about 1.4 million of US adults are now living with CHD. And then we have every 15 minutes, a baby is born with CHD. So some anatomy. So heart defects can affect different parts of the heart. So the heart chambers, there's four chambers in the heart. We have the two upper chambers called the atria that receive the blood. The two lower chambers called the ventricles pump blood out of the heart to other parts of the body. The septum, which is the wall that separates the right and the left side of the heart. There's a wall that separates the two atria and the two ventricles. Heart valves, these valves open and close and control the blood flow through the heart. They keep the flow pumping in the right direction as it goes to the other parts of the body. And then arteries and veins near the heart. The arteries are the blood vessels that carry blood away from the heart to the body. Veins are blood vessels that carry blood from the body to the heart. The aorta is the main artery that carries blood away from the heart to the rest of the body. And we have a diagram here of the heart. So I have another diagram here. So on the left, that is what a normal heart with all the chambers. The red part is the oxygenated blood. The blue part is the deoxygenated blood. And we have four congenital heart defects. As you can see with the atrial septal defect, the opening between the atria is where the mixed blood. The aortic coarctation, it actually has a narrowing of the aorta. The ventricular septal defect, there's a opening, so there's a hole between the two lower ventricles. And then the Fallot's tetralogy, there's an enlarged aortic valve. There's a hole between the ventricles. We have thickening of the right ventricular wall, and then the narrowing of the pulmonary valve and pulmonary artery. So symptoms may vary depending on the type of defect and then the severity of the defect. Some may have few symptoms, others may have none, but there's a range of different symptoms, but some can include blue tinted nails or lips. They might have fast or troubled breathing. They might become tired during feeding, and then babies are usually sleepy, but abnormal sleepiness. And then we have just another kind of diagram that shows where there's a defect, there's a hole, there's a leaky valve, and then defective vessels. So some more information on, we have three specific defects. The ventricular septal defect. So this occurs when the septum between the two ventricles doesn't fully develop, which causes or leaves a hole, and it causes blood to flow from the left ventricle through the ventricular septal defect to the right ventricle and into the lungs. This extra blood being pumped into the lung forces the heart and lungs to work harder, which causes complications. Some symptoms of that is shortness of breath, fast or heavy breathing, abnormal sweating, and then poor weight gain. For atrial septal defect, this occurs when there's a hole in the septum that divides the upper chamber of the heart, the atria. And this hole can vary in size, and it actually may close on its own or may require surgery. Some symptoms are difficulty breathing. You might actually hear a heart murmur. They may become tired during feeding, shortness of breath during activity. And then the dilatation of the aorta. This occurs when a part of the aorta is more narrower than usual. The narrowing blocks normal blood flow to the body. It can back up flow into the left ventricle of the heart, making the muscles work harder to get the blood out of the heart. And then some symptoms: difficulty breathing, heavy sweating, and pale skin. Some diagnosis and treatment. Some CHDs can be diagnosed during pregnancy using a special type of fetal ultrasound called the fetal echocardiogram, which creates an ultrasound pictures of the heart of the developing baby. And then some CHDs are not detected till after birth or actually later in life during childhood or even all the way up into adulthood. Pulse oximetry is an electronic device that measures the saturation of oxygen carried in the red blood cells. Once baby is born, their oxygen levels are continuously monitored. And then treatment depends on the type and severity of the defect. Some babies or infants may need one or more surgeries to repair the heart or the vessels. Some defects may not be fully repaired, but treatment to improve blood flow and the way the heart works. And it is important to remember that repairs may be done for the defect, but many with the congenital heart defects cannot be cured and will require lifelong follow-up care. So living with congenital heart defects. As medical care has advanced, infants born with CHD are living longer and healthier lives. Many entering adulthood living very independent with little to no difficulty. Others may develop a disability over time. Those with genetic problems or other health conditions definitely have a risk for a disability. And February 7th through the 14th is Congenital Heart Defect Awareness Week. And thank you so much. That was my presentation on congenital heart defects.